CNA Test Skills 2025. Question 1. What is the most important reason for using a mechanical lift to transfer clients? It saves time compared to manual transfers. It reduces the risk of injury to both the CNA and the client. It costs less than staff training. It does not require any staff assistance. The most important reason for using a mechanical lift is to reduce the risk of injury to both the CNA and the client. Mechanical lifts are essential for transferring clients who are unable to bear weight or who require complete assistance. Question 2. What are the first steps a CNA should take when preparing to make an occupied bed? Lower both side rails and remove all linens immediately. Raise the bed to a comfortable working height, lower the side rail on the working side, and ensure the patient's safety. Remove the pillows and place them on a chair. Raise all side rails to the highest position and begin making the bed. When making an occupied bed, first raise the bed to a comfortable working height, lower the side rail on your working side, and ensure the patient is safe and comfortable. This proper approach protects both the patient and your back. Question 3. Which of the following is an example of false imprisonment? Closing a door for privacy during care. Using a vest restraint without an order or emergency. Asking a resident to stay in the dining room for a meal. Walking a resident to the bathroom. Unauthorized restraint or preventing a resident from leaving an area is false imprisonment. Physical or chemical restraints require a physician's order and must be used only as a last resort for safety purposes. Question 4. What are the steps for applying one knee-high elastic stocking? Starting at the toes, turn the stocking inside out up to the heel, place it over the foot and toes, and gently pull it up. Roll the stocking from the top down, place the foot in, and unroll. Apply powder to the skin first to help it slide. Have the patient stand up, then pull the stocking into place. Turning the stocking inside out up to the heel allows for easier placement over the toes and foot without bunching. Gently pull it upward, smoothing out any wrinkles. Wrinkles can cause pressure, skin breakdown, and impede circulation. Question 5. Another CNA coming on shift approaches you in the crowded dining hall and asks you what cares you have already completed for Mrs. Smith. What is the most appropriate response? Give a detailed report right there in the dining hall. Say "I'm not sure" and walk away. Suggest moving to a private area to give report, as resident information is confidential. Write down the information on a piece of paper and hand it to the other CNA. Discussing resident information in a public area violates HIPAA. Always move to a private area or the nurse's station to give report. Confidentiality must be maintained at all times. Question 6. A resident refuses to take a bath. The CNA should tell the resident they must take a bath because it's in their care plan. Ignore the request and proceed with the bath. Respect the resident's right to refuse, report to the nurse, and document the refusal. Skip the bath and not tell anyone. Residents have the right to refuse care, even if it is necessary for their health. The CNA must respect this right, report the refusal to the nurse, and document it. Forcing care can lead to charges of assault or battery. Question 7. Complaints from residents are confidential. This procedure is guaranteed by the Resident Bill of Rights, facility policy only, state law only, local ordinances. The Resident Bill of Rights under OBRA, Omnibus Budget Reconciliation Act, guarantees that residents have the right to voice grievances and complaints without fear of retaliation or reprisal. Their complaints remain confidential. Question 8. A CNA sees another staff member taking a photo of a resident with their phone. What should the CNA do? Ignore it because it is not the CNA's business. Report the incident to the nurse immediately. Ask to be in the photo. Take a photo also. Taking photos of residents without consent violates client confidentiality and HIPAA. The CNA has a duty to report this immediately to the nurse to protect the resident's rights and privacy. Question 9. A patient's family asks the CNA caring for a loved one about the results of a recent blood test. What should the CNA say? I think everything is normal, which is great. Let me find the nurse to talk to you about the results. Oh, he had a blood test? That is news to me. I cannot comment on patient treatment. Sorry. The CNA should not comment on medical procedures or diagnostic information. The patient has a right to privacy. Refer family members to the nurse to discuss results or care information. Question 10. If a patient refuses treatment and the CNA performs this care on the patient anyway, what could happen to the CNA? Nothing. CNAs should always perform care regardless of patient wishes. The CNA could be given an award. The CNA could be promoted. The CNA could be charged with assault or battery. A CNA can be charged with assault for threatening to perform care or battery for touching a patient, providing care, without the patient's consent. Treating a patient without consent violates the patient's rights. Question 11. A CNA overhears another CNA threaten a resident. What must the CNA do? Stay silent to avoid conflict. Report the threat to the nurse immediately. Confront the other CNA in the hallway. Write an anonymous note and leave it on the desk. CNAs are mandatory reporters. Any suspected abuse, neglect, or threats against a resident must be reported immediately to the nurse and, if necessary, to state authorities. Failure to report can result in disciplinary action and loss of certification. Question 12. What is the difference between privacy and confidentiality in resident care? Privacy is about information, confidentiality is about physical spaces. Privacy is physical, closing curtains during care. Confidentiality is about information, not discussing residents publicly. Privacy is not legally protected, confidentiality is. There is no difference, they are the same. Privacy refers to physical boundaries and spaces during care, such as closing doors and curtains. Confidentiality refers to protecting personal health information, including not discussing residents in hallways or with uninvolved parties. Question 13. A female resident's husband has asked for some time alone with his wife in her room. What should the NA do? Let the husband visit but listen outside the door. Allow the visit and provide privacy. Tell the husband he must have a staff member present during visits. Remind the resident that she does not have to see her husband. Residents have the right to have visitors. The CNA should respect the request for privacy and allow the couple to have time alone unless the resident objects or safety concerns exist. Monitoring from inside the room would violate their privacy. Question 14. What is the CNA's responsibility if they suspect abuse? Keep the suspicion to themselves until they have proof. Discuss it with the suspected abuser first. Report it immediately to the nurse and follow facility and state reporting guidelines. Document it but keep it confidential between CNAs. CNAs are mandatory reporters. Suspected abuse must be reported immediately to the supervising nurse and, depending on state law, to Adult Protective Services or the state survey agency. CNAs do not need proof, only a reasonable suspicion. Question 15. A CNA notices an item that belongs to a resident inside another staff member's backpack. What is the most appropriate action for the CNA to take? Confront the staff member directly. Ignore it to avoid conflict. Tell the resident they probably lost it. Report what you saw to the nurse immediately. Suspected theft of resident property must be reported to the nurse immediately. CNAs have a duty to protect residents' personal possessions and report any suspicious activity involving resident belongings. Question 16. A CNA discovers a fire in a resident's room. What is the first action to take? Try to put out the fire with water. Call the fire department. Remove the resident from immediate danger, rescue first. Close the door and wait for instructions. The race protocol for fire safety begins with rescue. Remove residents from immediate danger first. Only after removing those in danger do you sound the alarm. A. Contain the fire. C. And extinguish if safe. E. Question 17. When there is a fire, what does the A stand for in the race fire safety protocol? Alarm. Alert. Ask. Assess. RACE stands for Rescue, Remove Residents from Immediate Danger, Alarm, Activate the Fire Alarm, Contain, Close Doors, Extinguish, Use a fire extinguisher if safe to do so. The directs you to sound the alarm after rescuing anyone in immediate danger. Question 18. A resident's wheelchair is found with both wheel locks unlocked. What should the CNA do? Ignore it and continue with cares. Lock both wheels before transferring the resident. Tell the resident to remind the staff. Only lock them if the resident is sitting in it. Wheel locks must always be locked before any transfer, whether the resident is getting in or out of the chair. Unlocked wheels can cause the chair to roll during transfer, leading to falls and serious injury. Question 19. What does the P in the pass fire extinguisher technique stand for? Point. Pull the pin. Press. Prepare. Pass stands for pull the pin, aim at the base of the fire, squeeze the handle, and sweep side to side. This sequence ensures effective use of a fire extinguisher if it is safe to use. Question 20. What is the first thing you should do if you find a resident on the floor? Immediately help the resident up. Call for help and do not move the resident until the nurse assesses them. Check the resident's pulse and begin CPR. Get a wheelchair to move the resident. Stay with the resident, call for help immediately, and do not move them until a nurse has assessed the situation. Moving a resident who has fallen could worsen a fracture or spinal injury. Your role is to keep the resident calm and safe until the nurse evaluates them.